Mr. Secretary, thank you for making time. I really appreciate it.
Yeah.
You've come to the Speedway to talk with frontline medical workers, to tour this mobile hospital. What have you learned, and what is your message today?
Well, first, it's really great to be here with our healthcare workers, because our healthcare workers have been so heroic throughout this. I got to go over and see the mobile testing center that Atrium has set up here at the Speedway. And I believe I learned that through all of their mobile testing centers, they've done over 20,000 people have been able to get tested there, and got to thank all of the workers who were there in their personal protective equipment, taking care of everyone here. And then now over here at Med 1, we're parked on the parking lot outside of the main Speedway, and they're getting ready for the race this weekend as part of getting America back to work and getting us out socializing and getting our sporting activities going again. Med 1 from Atrium is here as an emergency room, mobile hospital setup, and just to see this incredible technology around us here that's part of a partnership between the U.S. government originally and Atrium, and now supported and run by Atrium fully. Just incredible to see the nurses, the doctors, everyone here to make the race this weekend safe.
South Carolina has opened up more. North Carolina is getting ready to go into phase 2 Friday. Why does the president and yourself feel like these are wise decisions?
So thanks to President Trump's historic response on the coronavirus, we're now enabled to have states have the flexibility to do reopening and get America back to work. We've got the testing in place, we've got the surveillance in place, we have the containment procedures in place with the public health workers who can identify cases and contact trace. We're seeing positive developments in terms of where the cases are going in the United States and where fatalities are going. And now it's really up to state governors, flexibility to look at your community situation and decide, are the circumstances right to reopen, and what type of reopening should you have? So there's a lot of flexibility, and we're going to see a diversity of approaches, and we're going to be able to collect data and see what works best as we go through this. But we're really delighted to see Governor Cooper, of course, now moving to phase 2 of his reopening plan to get people back, because we describe this often as health versus the economy, but I think it's more appropriate to describe it as health versus health, because there are very real health consequences of being sheltered in place and being closed down and shut down. We see higher suicides when we see economic dislocation. We've seen a radical decline in cancer screenings, a radical decline in vaccinations, especially pediatric vaccinations. And so these are real health consequences that have to be weighed against the benefits of disease prevention from coronavirus.
I know you can't talk politics or the outcome of an election, but the Republican National Convention, the floor is kind of like a rock concert at times. Can you make any comment about how that will be done safely, and if there's any contingency plans being made now?
So as you mentioned, I can't speak to any political parties, conventions, or activities, but I know we're committed to working to get as many gatherings as we can up and running as safely as possible. But we'll have to, there's a bit of time for that. We've got a couple months away, and we're going to see how the epidemiology goes, what the circumstances are in the country at the time of sports gatherings and other mass gatherings, whether conventions or concerts or otherwise. And I think we'll all just take the best science and evidence-based approaches at that time. The important message is that we can get back to work, we can get back to school using the tools that we have. And that means some smart choices about keeping a little bit of social distance, wearing a mask, also avoiding unnecessary gatherings. So for instance, one approach with our schools can be the kids maybe go back, but they're distanced in the classroom, and you avoid mass gatherings of the kids like assembly hall and other events like that. So a lot of smart approaches, but here's the game plan. We need to have first, and we do, broad surveillance. So we look across the country with our deep data systems to look for any symptoms that are out there, surges that look consistent with outbreaks of coronavirus. We test all of those people for coronavirus with our world-class testing system that we now have. So we test everyone who's got symptoms. Then we also test asymptomatic people. So we go to our senior living centers, we go to meat packing plants, prisons, other places that are very susceptible to outbreaks. We test even asymptomatic people to see, are we seeing community spreading of the disease there? And then where we get positive cases, we surge in, we contain it, we test people, we test the contacts of the people who are positive, we isolate them, we treat them. And we have the health resources, as we're seeing today, with personal protective equipment and supplies to be able to manage disease. And we bring therapeutics to the people, like we've approved remdesivir for use as a therapeutic. We've got Operation Warp Speed that's driving work on other therapeutics. And we're working to get vaccines by the end of this year so that that can all be part of a multi-factor strategy, getting this country back up and running, get people back to normal.
And finally, you are well aware of the data. Mecklenburg County, the state of North Carolina, we're seeing higher rates of infection among African Americans and Latino population. What new steps are you taking to bring those rates down?
Yeah, so we're obviously extremely concerned as we see infection rates as well as the severity of impact in minority communities. So the CDC and NIH are doing many studies to try to get to the bottom of why we're seeing that and what interventions can be done. We, through our Office of Minority Health at HHS, are funding programs of outreach, education to minority communities in particular. We've worked to surge testing equipment and testing programs in. Atrium, for instance, has a mobile testing unit that they've deployed into minority communities and underserved communities. And actually, the CEO of Atrium was informing me they've actually been able to get the testing rates in those communities to be equivalent to non-underserved communities, which is a very important advance. And we've worked at the national government by deploying testing to the Indian Health Service and to underserved communities. Over $500 million for testing at our community health centers, which are a backbone of service to our underserved communities. Majority of the clients being from minority populations who are served by our community health centers. So get aggressive testing out there, make sure we've got the health capacity, get the culturally sensitive community outreach and healthcare outreach and education. Those are some of the approaches, but we've got a lot more to do.
Well, thank you very much.
Great, thank you. Good to be with you.
Thank you, everyone.
Thank you.
Thank you, Mike.